What gives you ultimate satisfaction? Are you fulfilled when you've been able to lend a hand to someone who is unable to help themselves? The healthcare profession is all about care. And that is what I preach. My name is Bridget Ezeobiakor, and this is Bridging Healthcare. In this channel, I will teach you on steps to become a healthcare professional and how to be efficient at it. Welcome. Hello everyone, and welcome to my channel. My name is Bridget, and this is Bridging Healthcare. It's such an honor to be back again to talk about what I love talking about, which is health and social care. And today I'm going to officially start a series, and I'm going to be teaching various courses that you will find in the NVQ level 2, level 3, depending on what you're doing. So if you are doing the level 2, the level 3, and you're finding it difficult to do your assignments, or you're struggling with a few things, I'm here to support. I'm not speaking as an authority, but I'm speaking as someone who has gone through training, and all the things I'm saying are things I've learned by books, by experience. Like I always say in this channel, is a mesh of academics and experience. And so I want you to just listen, and this might just be very useful for you. So today I want to start on a new topic, and I want to talk about health. What is health? So a lot of people say health is wealth. Health is, there are many definitions, but I'll start my definition by the WHO definition, that is World Health Organization. World Health Organization defined health as a complete state of well-being in your physical state of health, and I'm paraphrasing, in your mental state of health, and in your social state of health. So World Health Organization is saying that health is the absence of sickness and infirmity. World Health Organization, their definition is it's quite detailed, but it's not detailed enough. But I will start from there. So what World Health Organization is saying is that you are considered healthy if physically you are healthy, that is the homeostasis of your body from inside, your organs are functioning normally, your brain is functioning normally, your system is functioning normally. Then the mental health, that means your mind, the state of your mind, your mind is stable, you're able to manage relationship, people, you're able to think straight, your cognition is good, you can speak, you can think, you can communicate, you can understand, your senses are working, and your mind is also stable. And then it talked about social health, which involves your relationship with your environment, how you interact with people around you, how you interact with situations around you. And it says it's the absence of sickness and infirmity. It is good enough, but I just think that it's not all encompassing, So does that mean that if somebody is okay physically, but mentally they are not okay, does it mean they are not healthy? Or does it mean if someone is okay mentally and they're okay physically, but they don't have any social interactions with the environment or the community or people around them, does it mean that they are not healthy? Come to think of it, there's a thin line between healthy and unhealthy. I've done quite a lot of research on this, and it's something I've been working on lately. I worked on it till late last night, and that's where I want to start. There are other body of knowledge that have tried to define health. They have defined it as a state of well-being, where you are physically healthy. There are different. Okay, so let me start. There's six parameters. There's a body of knowledge that believes in 6 parameters, which talks about your physical health, it talks about your mental health, it talks about your spiritual health, it talks about your social well-being, it talks about your environmental health, and it also talked about your cognition. So, so I think that spiritual health is a big part of being healthy. I think that your relational health is a part of being healthy. And, the other body of knowledge that says there are 9 parameters, it includes financial health, so if you're not working, you don't have finance, it's a kind of sickness or it's a kind of unhealthiness. And then there's the one that also talks about work, like you are able to fulfill your dreams, you are contributing to the society, which is also part of health. It's part of being healthy. So what can somebody be absolutely healthy? Well, if we're judging by all these parameters, there's a thin line between being healthy and not being healthy. It's possible to be absolutely healthy, but it's very rare. Like, what if everything is fine, my health is okay, but my hair is not growing? All these things I consider as part of being healthy, So when we're considering that someone is healthy, that means you have to pick the physical parameters. So they will do tests, they will run tests. So the doctors will check on them and see that their organs are working, their blood function and everything. Then you now have the mental parameters, which will be checked by people like mental health doctors, physiotherapists, psychologists and all that. Then you now have the social check, and that one, it's unique because how can you measure social health? So you're looking at how they interact with people in the community, family, friends, colleagues, how they interact with their environment and changing environment, how they interact with changing environment. So that is how you measure health in terms of the social space. And there are so many things, there are so many therapies that I use. I've heard about the snooze therapy, I've heard about the, I can't remember the name now, but I've heard about so many different therapies that I use to measure social health. Meeting people, having a conversation with them. Are they able to sustain a conversation? Do they even know what is going on in the environment? Are they aware of the politics? Are they aware of the weather? Are they in good terms with their family? Are they communicating with their friends? Do you have a neighbor that you've never met before? Do you feel shy to maintain a conversation? So, all those are in social health. And then you now have financial health. And financial health is somewhat linked to social health, is linked to your professional health. If you don't have a job and there's no source of income coming in, it can cause financial sickness, which can also lead to a mental sickness, which can also lead to a social sickness, which can also lead to a physical sickness. You see, they are all interconnected. So how does he play in the health and social care space? So as a healthcare professional, you are supporting someone who is unable to help themselves meet the needs that you are supporting them to meet. So that means that that person is unhealthy in one aspect of life. It does not mean that you as a healthcare professional is 100% healthy, but you are able to support that person, or you are being deemed fit enough to support that person. So they might have physical concerns. It may not be physical. It may be mental. It may be social. It may, so like for instance, let me take a condition, autism. Autism as a condition. Now, autism is a spectrum. So there are some people that are on different ends of the spectrum and they symptomize differently. There are some people that if you see them, you will never know that they live with autism. And autism, one of the major symptoms or major challenges of people that live with autism is social health. They are not able to sustain relationship. They don't know when to say something and when not to say it. They don't know when to draw the line. It's one of the concerns. And people that also have cognitive disabilities, some people, they will just blot something out because they don't know that you're not supposed to say these things like this in public. Let me give you an instance. I once was speaking to someone and we were having a meal and the person just talked about, poo, which was weird, right? So a lot of people, when they communicate, they may be communicating you might see their concerns or the infirmity they do live with in that communication. That's why, as a healthcare professional, you have to understand your client. Some people do not live with physical disability, they live with mental or social or whatever it is. And that's why in the Western world you see that the social sector ensure that people that are maybe at home due to a cognitive problem or a mental problem and are not able to work do get something that is called like a support from the government that meets their financial needs. That way they are not financially sick as well. So what am I tying this to? One, you as a healthcare professional, you need to check yourself. Are you healthy? Do you do yearly checks? Do you do blood tests to check how your body is doing? That's number one. Number two, you need to be empathetic. It helps you to be empathetic when you know that the person that you are going to support needs help because they are not healthy in one particular aspect. Number three, it helps you to know how to treat people. Someone might not be sick physically, like I said, or mentally, but they might be sick socially. And we need to respect everyone. Remember, it's very difficult to find somebody that is in perfect health. So don't be too arrogant. I hope this class has been able to introduce health in a layman's language. I'm still going to delve deep in other videos, but I want us to pick this one and at least have that definition that there's a thin line between being healthy and unhealthy, and being completely healthy can be achieved. It's possible, I believe. Spiritual health is something I've also not talked about. So in the next session, we're going to be delving deep into all these aspects of health. Guys, please do not forget to subscribe, like, and share. Let's grow the community. Let's help each other. If you are doing your NVQ or you are writing any care skill course, you are trying to better yourself, I'm here to support. You can always send me an email at ezeobiakorbridget@gmail.com and I'm willing to help you out. See you in the next one.